Rolling right along into the next chunk, hemodynamic disorders, a lot of our blood clotting, blood type issues, that I grouped all together in the cardiovascular system, so we will see all of that down below. Moving into the next chunk of material, the genetic and congenital disorders. This makes up approximately 10% of all of the questions that you can get for the pathology portion. Starting with the chromosomal disorders, these next couple of videos, we're going to split up and make them a little bit shorter, just so that we have a little bit of time to kind of digest this information. The most important things that we need to know about these conditions, we need to know the name of the condition. We need to know what the cause is. Which chromosome, which specific part of the chromosome, is it an extra copy, is it X-linked, that sort of information. That's what we want to focus on. And then, of course, we will have some of the common features of each of those, some of the keywords that they can pull up for the testing. Starting off with Angelman syndrome, this is often misdiagnosed as autism. They have very similar looking features, as well as they tend to have a very happy demeanor, and they frequently laugh. It's almost like an uncontrollable, consistent laughter. In some cases, Angelman syndrome can be associated with seizures, which they potentially suspect to be part of why the laughter occurs. That specific detail isn't usually tested on part 1, so don't worry about that. This is a loss of function of this specific gene, the UBE3A gene, on chromosome 15. They don't typically ask about the specific gene, except for 1 or 2 conditions that we'll see later. Focus mainly on the chromosome number. So this is a loss of function of a gene on chromosome 15. Cry-do-chat syndrome, very rarely ever tested. This is deletion of part of chromosome 5, so you get developmental delays and what they call cat-like cry in infancy. Down syndrome, aka trisomy 21 disorder. This is where there is an extra copy of chromosome 21, so they end up with a 47 chromosomes instead of the normal 46. With this, some of the biggest questions that you get asked is about the atlantodental interval, most commonly looked at from a lateral cervical view. We always want to take flexion and extension views before adjusting the cervical spine in this area, as it is a common thing to have with Down syndrome patients, an increased ADI interval, which, if we adjust it, could potentially cause damage to the spinal cord, and specifically the brain stem in that area. Another common thing that they ask about is the simian crease. This is where on everybody's palm we typically have 2 lines, one line above coming from one side, another line below that, compared to those with trisomy 21 disorder. They just have one straight line all the way across, known as the simian crease or the transverse palmar crease. Edwards syndrome, this is trisomy 18. The specific things that we look at here, we talk about heart defects, we talk about a high mortality rate, and rocker bottom feet. See these feet, they kind of have this rounded shape to them, a little bit of deformation. That is due to trisomy 18 disorder. Fragile X syndrome, it's in the name. This affects the X chromosome. The X chromosome is 100% always given by the mother, and then depending on whether male or female, given by the father. Most commonly, whenever we talk about X chromosome related diseases, we're always going to look towards the genetic history of the mother, because when the mothers have 2 X chromosomes, and so they can have a mutated chromosome and a normal chromosome, and they can live just fine. However, the issue becomes, especially in males are much more likely to have these type of conditions, because if they get the one X chromosome from their mother that happens to be mutated, then they 100% are going to have the condition. So Fragile X syndrome, we have a fragile site at the XQ27. That occasionally, the specific spot is occasionally mentioned for Fragile X syndrome. This is actually the most common form of mild mental retardation. That's the key word, mild. I should clarify, mild in females and more moderate to severe mental retardation in males. Klinefelter syndrome, Klinefelter, as well as Turner syndrome are two that are quite often asked about on boards. This is where males have an extra X chromosome. So this is the karyotype XXY. So they have two X chromosomes and a Y chromosome. They are technically classified as male, but they have female characteristics, often being reduced muscle mass, infertility issues. Gynecomastia is the big one, the development of breast tissue, and that's that 47XXY karyotype. Patau syndrome, most commonly, we associate Patau syndrome, trisomy 13, with the cleft lip and the palate, as well as polydactyly. This is typically having extra fingers or toes develop on the hands and the feet. Very short life expectancy. Actually had an older brother, one who was born before me, with trisomy 13 disorder and only survived about an hour and a half outside of the womb. So this is when they have an extra copy of 13. Lots of issues, heart defects, lung defects, the polydactyly, and then the cleft lip or the palate, and very short life expectancy. Prader-Willi syndrome. This again is chromosome 15. Not often asked. The big thing that we know about this is that they have insatiable hunger. Basically, their hunger reflex, the communication between their stomach and their brain, doesn't form properly, and so they never get the signal that they are full. So they constantly feel like they are starving and need to be eating. Turner syndrome, this is monosomy X. This is where we actually don't have a second sex chromosome. So we classify these people as females, but they have only one X chromosome. I should say its X chromosome is either missing or incomplete. Most commonly, they'll ask questions about it being missing. So it's a 45XO karyotype. The O is the placeholder saying that it is empty. Typically, they will have a short stature, a webbed neck. This is typically the identifier, saying that they're short and they have a webbed neck. Not to be confused with what is known as Klippel syndrome. That is a different condition, more directly related to the skeletal structure, not necessarily the chromosome structure. So we'll look at the difference. This is going to be a female, webbed neck, infertility, 45XO karyotype. Finally, Williams syndrome. This is a genetic disorder with a deletion on chromosome 7. So you get some cardiovascular issues, mild to moderate intellectual disabilities, and that's about it. Again, going through this stuff, focus on what is bolded. Focus on what is bolded and highlighted in the normal boxes. Focus less on the purpley, pink-purple boxes, and the stuff to know if you're going to study those is the bolded material in there. Okay, we'll continue on next chunk with the inborn errors of metabolism.